Hey guys, my name is Dr. Durotten and I am a regenerative medicine physician in the Phoenix Valley and I work in the field of orthobiologics. So what does this mean? Well, what this means is that on a daily basis, I'm working to try to help athletes as well as regular everyday patients to improve their connective tissue health, which includes ligaments and tendons, as well as improve their overall joint health. And we do this as an isolated non-surgical approach, as well as we do it sometimes in conjunction with a surgical approach that the surgeon is going to pursue in order to try to help maximize the surgical outcome. And we do that only if it's indicated in that certain case. But I know that everybody was watching the Tyrese Haliburton clip where he tore his Achilles tendon in the NBA Finals. And I thought it would be an amazing time to review Achilles tendon anatomy and what happens during a rupture. So I made a little chart here, which is some of the basics of the Achilles tendon. We can go into so much more, but this is hopefully a good highlight reel. So we have our Achilles tendon. It's the largest and strongest tendon in the human body, and a lot of people don't realize that. And it's made up mostly of type 1 collagen as well as a little bit of elastin. And just a overarching perspective on connective tissue anatomy, a ligament attaches a bone to a bone, and a tendon attaches a muscle to a bone. And so if we're dealing with the Achilles tendon, the tendon is attached on one side to a bone and on the other side to a muscle. And the muscle which is involved in the Achilles tendon on one side is actually called the triceps surae muscle. It's called this because there's actually 3 muscles that are involved in this overarching muscle. So the first muscle is the lateral head of the gastrocnemius. The second muscle is the medial head of the gastrocnemius. And the third muscle is the soleus muscle. And I have a little model here so that you guys can understand the basics of this anatomy. So this is our lower extremity here, and we have our tibia bone and our fibula bone. Up here above, which is not shown, is our femur, but it sits right here on top of the tibia. And down here we have our calcaneus and our talus bone here below the tibia. And here would be considered the lateral malleolus of the fibula. And important things to understand. So the lateral and medial head of the gastrocnemius are going to insert on the lateral and medial femoral condyles up here above. And I said insert, but really we mean more of an origin of that muscle. And so the soleus as well is going to have an origin up here towards the top, and it's going to be right along the soleal line on the tibia as well as portions of the fibula. And then as these tendons up here turn into muscle, and then they start to come down the back of the lower extremity, and then at the distal portions it's going to turn into a tendon or a connective tissue again so that it can insert on the bone down here on the calcaneus. And as it does this, a lot of people don't realize this, but I have a diagram here of the calcaneus and the different facets that make up the attachment of the Achilles tendon. There's actually 3 facets. We call them facets. Yes, that's a similar term to what we use in the spine. You have a superior facet, a middle facet, and an inferior facet. And on the superior facet, we have the retrocalcaneal bursa. On the middle facet, you're gonna have the lateral head of the gastrocnemius and the soleus, and on the inferior facet, extending across the whole length of the facet, is going to be the medial head of the gastrocnemius. And this whole insertion is actually done so in a crescent shape so that it distributes the load and helps to maximize the forces with which our Achilles tendon can handle. And a lot of people don't realize this, but most of the Achilles tendon ruptures actually happen in the mid portion of the tendon. So it's not typically going to rupture down here directly on the bone, but it'll rupture kind of more towards the middle, actually about 2 to 6 centimeters proximal to the calcaneal insertion. The reason that these ruptures typically happen in this portion of the tendon is because this is a very hypovascular area. So it's an area where the tendon does not get a lot of blood flow. And this is such an important concept, and it overlaps on all of the patients that we typically see, because ligaments and tendons and connective tissue don't normally get a lot of blood flow. And that's what makes them a lot harder to heal compared to something like a muscle. When you have a muscle strain, typically people improve a lot faster than if you tear a tendon and connective tissue. And one overarching way to look at this is when you look at muscle, it's typically red. And when you look at connective tissue, it's typically white. This isn't always the exact distinction, but muscle has a lot of blood flow, and ligament and tendon typically don't have a lot of blood flow. And this is the area which has the least amount of blood flow, and therefore why it's the most at risk of rupture. All right, guys, I hope this helped you to understand Achilles tendon anatomy and put a little bit more perspective on what happened to Tyrese Haliburton in the NBA Finals.